It is a very like a disastrous condition for a couple, especially for the female, because the female has become pregnant but she never had a baby. Thyroid hormone is also very notorious and it is also responsible for abortion in many of the cases. So in those cases, like, you're just not pregnant and you're just biochemically pregnant. Miscarriages, or you can say miscarriage once also. So it is like the stock has come, but the stock did not, it just visited you and it just left. So ultimately you didn't end up having a baby. You didn't end up listening to the baby's words, the coo of the baby, or you were not able to take the baby in your arms. So it is a very like a disastrous condition for a couple, especially for the female, because the female has become pregnant but she never had a baby. So talking about miscarriage or abortion is a very important thing for the couples. So they should know that when miscarriage happens and why miscarriage happens, and is there anything that they can do to prevent these miscarriages. Because whenever a miscarriage happens, the couple always blames themselves for the miscarriage. Usually the female, because you think that, okay, you did this thing that day and so the miscarriage happened. But it is not like that. There are many things which are in interplay when you're having a miscarriage. So let's divide your pregnancy into trimesters, which you must have heard. So we have got the first trimester, we have got the second trimester, and we have got the last trimester. So let's talk about first trimester miscarriages first. And before talking about that, let me tell you one thing, that whether you are conceiving naturally or you are undergoing an IVF procedure and you have a miscarriage, it then falls in the same boat. The management is also the same and everything we have to do for the patient is the same. So first and foremost, let us talk about first trimester miscarriages, and let's begin from the 4th week of pregnancy. So it's the 4th week of pregnancy and you are doing a urine pregnancy test on yourself and the pregnancy test is positive. You have got 2 lines and you are like elated, okay, now like you are pregnant, you're a mother now. But what happens when you go for your ultrasound after 1 week to see the sac, the gestational sac of the baby? You don't have any sac. So it is then what we give it a term, it is a biochemical pregnancy. So in a biochemical pregnancy, what happens? The pregnancy hormones, that is the serum beta HCG, that only rises in your blood, but you don't have a sac, you don't have a G sac in yourself. So in those cases, like, you're just not pregnant and you're just biochemically pregnant. Second scenario is that the sac is there and when you go for a repeat scan after 1 week, again for the cardiac activity, you don't see any cardiac activity. So then again it's the same, you have seen a fetal pole, everything, there is no cardiac activity, the cardiac activity is missing, so it's a dead baby. The doctor tells you to go for an abortion. Fourth scenario is you have a good cardiac activity and then after some weeks, maybe after 8 weeks, 9 weeks, you start having spotting and when you go for the scan, there is no cardiac activity. Or there is a cardiac activity but the baby that is inside you, the fetus, is non-salvageable. You are undergoing a threatened abortion. So these are some of the scenarios, and now let us talk that why it has happened to you, why you are only the person who are suffering from it. So first and foremost, there are things that are involved in making a baby. You have to understand that. So it is made from the oocyte, your eggs, your husband's sperms, and it is prepared inside your tubes and it is implanted in your uterus and it grows in your uterus. So basically the uterus is the place where it is nurtured and it grows there. So we have to see whether the uterus is having any problem or not. You might be having some problem in the uterus. You might be having a big fibroid inside your uterus which is not letting it grow. Not in the uterus specifically, I say in the endometrial cavity where the baby is kept. So if in the uterus there is a fibroid, there is nothing to worry, but anything that is present in the endometrial cavity is a source of worry for us. So the endometrial cavity has to be totally clean for the baby to grow. So first and foremost, we need to see you for this. Secondly, we need to see you medically, whether you are suffering from any medical disorder during pregnancy. Like, you might be normal, but during the gestational period,